Hello and welcome to my channel. I'm Dr. Aisha Munk, a neuroscientist, licensed psychologist, and medical doctor. On this channel, we dive deep into the fascinating connections between the brain, emotions, and relationships, helping you better understand yourself and the people you love. Today's topic is one that resonates with many of us. How do traumatic childhood experiences shape our relationships as adults? We're going beyond just relationships. We'll explore adult attachment styles both in and outside of relationships and how your inner child plays a role in your emotional responses. Have you ever reacted during a conflict in a way that felt irrational or overly emotional? Maybe you felt deeply hurt, angry, or rejected, almost as if you were a child again. These reactions often stem from attachment patterns and unresolved emotional wounds from childhood. The good news, by understanding these dynamics, you can break free from old patterns and start healing. Here is what we'll cover today. Attachment theory, how childhood experiences from the blueprint for your adult relationships. Adult attachment styles, their characteristics both in and outside of relationships. Attachment in adult relationships, how attachment styles influence behaviors, conflicts, and connection. The inner child, what it is, how it influences adult attachment, and why it holds the key to healing. The science of trauma, including the ACE study, Bella study, and Mikulinton and Shaver's research on attachment and mental health. What happens in your brain during trauma and triggers, including how the amygdala, hippocampus, and prefrontal cortex respond. Inner child reactions in relationships, common triggers, and how they connect to your attachment style. How to recognize your triggers and manage them effectively with practical strategies for self-regulation, affirmations to comfort your inner child and rewire your emotional responses. By the end of this video, you'll have a deeper understanding of why you react the way you do and actionable steps to heal, grow, and create healthier, more fulfilling relationships. Attachment theory, the blueprint for relationships. Attachment theory, developed by John Bowlby and Mary Ainsworth in the 60s, 70s, explains how the emotional bonds we form with our caregivers as children shape the way we connect with others throughout life. These early experiences create your attachment style, which becomes the foundation for your adult relationships. These are the 4 childhood attachment styles. Secure attachment, what it looks like in childhood. Caregivers are consistently loving, responsive, and supportive. The child might cry when the caregiver leaves the room, but quickly calm down when the caregiver comes back. What's the impact in adulthood? Secure adults are comfortable with intimacy, trust their partners, and communicate openly during conflicts. Insecure avoidant attachment, what it looks like in childhood. Caregivers are emotionally unavailable or dismissive, teaching the child to suppress their needs. The child might show no reaction when the caregiver leaves the room and no reaction when he or she comes back, but will be very upset inside, just doesn't show it. What's the impact in adulthood? Avoidantly attached adults may avoid emotional intimacy, prioritize independence, and struggle with vulnerability. Insecure, ambivalent, anxious attachment, what it looks like in childhood. Caregivers are inconsistent, sometimes attentive, sometimes neglectful. The child might show no reaction when the caregiver leaves the room, but be very angry when the caregiver comes back. What's the impact in adulthood? Anxiously attached adults often fear abandonment, seek constant reassurance, and may feel overly dependent on their partners. 4th, disorganized attachment, what it looks like in childhood. Caregivers are a source of both comfort and fear, often due to abuse or neglect. The child might show disorganized reaction or behavior when the caregiver leaves the room, such as just lying on the floor, not reacting, or being frozen. What's the impact in adulthood? Disorganized attachment often results in unstable relationships, mistrust, and heightened emotional reactivity. Now we are going to talk about adult attachment. Your attachment style doesn't just affect your romantic partnership, it influences many areas of your life. People with secure attachment show the following traits, usually, such as being confident, resilient, and emotionally balanced. Securely attached adults tend to seek help and support when needed and manage stress effectively. They feel comfortable forming close friendships and working collaboratively. People with avoidant attachment tend to show the following traits: independent and self-reliant, but emotionally distant. Avoidantly attached adults may struggle to ask for help or express vulnerability. They might avoid depending on others, even in friendships or at work. They focus on tasks and achievements rather than emotional connection. Anxious attachment tend to have these traits: being emotionally sensitive and often insecure. Adults with anxious attachment might overanalyze interactions and fear rejection in friendships or at work. They might seek constant validation from peers, mentors, or colleagues. They might experience difficulty trusting others and balancing boundaries. Adults with disorganized attachment might show the following traits. They might be fearful, mistrusting, and conflicted. Adults with disorganized attachment may struggle with intense anxiety in social or professional settings. They alternate between wanting closeness and pushing people away. They find it challenging to regulate emotions in high-pressure situations. Your attachment style becomes even more pronounced in romantic partnerships because these relationships mirror the attachment dynamics you experienced in childhood. Secure attachment in relationships shows such behaviors as communicating openly, resolving conflicts constructively, and giving and receiving emotional support. For example, if a partner needs space after an argument, a securely attached person can respect that boundary without feeling rejected. Avoidant attachment in relationships. Behaviors are like emotional withdrawal, reluctance to share feelings, and valuing independence over closeness. For example, when a partner asks for emotional support, an avoidantly attached person might feel overwhelmed or shut down in saying, "I don't want to talk about it. I can't right now." Anxious attachment in relationships shows behaviors such as clinginess, fear of abandonment, and seeking constant reassurance. For example, if a partner doesn't immediately respond to a text, an anxiously attached person might spiral into fear, thinking they don't care about me anymore. Disorganized attachment in relationships shows behaviors such as intense emotional ups and downs, mistrust, and difficulty regulating emotions. For example, a partner's actions might provoke both a desire for closeness and a fear of being hurt, leading to conflicting behavior like clinging one moment and pushing away the next. The inner child represents the wounded part of you that holds the fears, pain, and unmet needs of your younger self. It's closely tied to your attachment style because the same patterns you developed in childhood to feel safe often resurface in adult relationships. When you're triggered in a relationship, it's often your inner child reacting, not your rational adult self. For example, the trigger, your partner criticizes you. Your inner child reaction, "I'm not good enough. I'll never be good enough." Your adult behavior, you become defensive, lash out, or shut down emotionally. Let's talk a little bit about the science of trauma. The ACE study, the Bella study, and more. The ACE study, so Adverse Childhood Experience study, revealed that early trauma profoundly impacts mental, emotional, and physical health. Key findings were that those with more than 4 ACEs are more likely to experience depression, anxiety, post-traumatic stress disorder, and unstable relationships. ACEs often lead to attachment insecurities and difficulty managing emotions in adulthood and are also related to problems in physical health. The Bella study in Germany from 2017. The Bella study confirmed that unresolved childhood trauma leads to emotional dysregulation, impulsivity, and avoidance behaviors in adult relationships. Mikulincer's and Shaver's research. This research showed that insecure attachment intensifies stress responses, making conflicts feel overwhelming. Secure relationships or therapy can help calm these heightened reactions. So, what happens in your brain during trauma and triggers? First, the amygdala, the alarm system. Its role, it activates the fight, flight, or freeze response. The impact in adulthood is that a hyperactive amygdala causes you to overreact to perceived threats in your relationships. Second, the hippocampus, your emotional memory storage. It processes and stores memories. Its impact, it triggers, activates, store memories of past pain, making current situations feel as distressing as the original trauma. The prefrontal cortex, the rational brain, it regulates emotions and impulse control. Trauma weakens this area, making it harder to pause and respond thoughtfully during conflicts. I will tell you now about 8 inner child reactions in relationships. First, fear of abandonment, triggered by a partner needing space. For example, they're going to leave me. I need to fix this now. Second, defensiveness to criticism, triggered by feedback from your partner. For example, I'm not good enough. I feel attacked. Third, clinging after conflict, triggered by a fear of losing the relationship. For example, if I don't fix this right now, they'll leave me. Fourth, jealousy and insecurity, triggered by comparisons or mentions of an ex. For example, I'm not special enough to keep their attention. Fifth, avoiding emotional intimacy, triggered by vulnerability or emotional closeness. For example, it's safer to shut down than risk being hurt. 6, silent treatment, triggered by feeling dismissed. For example, I'll withdraw completely to protect myself. 7, explosive anger, triggered by feeling powerless or unheard. For example, no one listens to me and I can't take it anymore. 8, hyper-independence, triggered by fear of relying on others. For example, if I depend on them, I'll only get hurt. So next, I'm going to give you 10 affirmations to comfort your inner child. When you feel triggered, affirmations can help you calm your emotional response. First, you're safe now. I'll protect you. Second, your feelings are valid. It's okay to feel this way. Third, you don't have to be perfect to be loved. Fourth, what happened to you wasn't your fault. Fifth, you're not alone anymore. I'll always be here for you. 6, you are enough, just as you are. 7, it's okay to cry. Your emotions are valid. 8, you've survived so much, and I'm proud of you. 9, you're strong, and you deserve love and happiness. 10, together we'll create a brighter future. So you tell this as your adult self to your inner child. Keep doing this and you'll feel more secure, I promise. So here's what we covered today. Attachment theory and adult attachment styles. It basically explains how childhood shapes your relationships and your overall behavior. The inner child holds the key to understanding emotional triggers and healing from past pain. Research like the ACE study highlights the profound impact of early trauma on adult emotional regulation and attachment. Healing is possible. Recognizing triggers, self-soothing, and seeking therapy can help you rewire old patterns and create secure, fulfilling relationships. Thank you for joining me today. Healing is a journey, but every step forward brings you closer to the love and life you deserve. Share your thoughts in the comments and don't forget to subscribe for more insight into relationships, personal growth, psychology, and mental health and health. See you next time.